Middletown Board of Health meeting for Tuesday, November 14th, 2023. Amanda, could you please call the roll for us?
Mayor Condrey?
Here.
Mr. Richmond?
Here.
Ms. Cash? Ms. Sipsey?
Here.
Ms. Miller? Ms. Lawley?
Here.
Mr. Bonnell?
Here.
Dr. Zoll?
We have everybody. Ta-da. Great. Any citizen comments today? You too can come to the Board of Health meeting at 7:30 a.m. on the second Tuesday of every month and come comment. It'd be nice to have you. Okay. You like that? That's a good call out. People in here? Hi. We've got the minutes for October 2023. Do we have any corrections on those or any comments before we?
I did. It was the section where we talk about central connections, and Sunrise Treatment Center had volunteered to come in and do deep cleaning, and in the minutes it said they contracted with somebody. So I just wanted to make that correction, because I believe all the supplies were provided by the city.
Yep.
Right?
Mhm.
Yeah.
Nice catch. Okay, hearing nothing else, do we have a motion to receive, to approve the minutes from October of 2023?
Second.
All in favor? All opposed? Okay, minutes have been approved. The financial report for October 2023, do we have a motion to receive and file that, or any comments before that? Any motion to receive and file the financial report?
So moved.
Second. Is that, who moved? Is that it? Oh, okay. I just heard a rumble. Okay, great. Did you get that in?
Yeah.
Okay. All in favor? All opposed? Okay. Financial report has been received and filed. We have an education presentation today on lead.
Okay, so, thought we'd switch it up a little bit and, go to something that's more childhood-based this month, for lead poisoning. So, what is it? Most of us know that lead is a naturally occurring heavy metal found in the earth's soil, and we use it for manufacturing, metals, bullets, batteries, used in paints, used to be used in gasoline when we were all little people. That has since gone away. It's not widely used in paints anymore, but it is still in paint that we see on and in homes. Why do we worry about lead since we took it out of gasoline and emissions? Because it does still cause damage to brain and nervous system of developing children. Can slow their growth physically and developmentally, cause learning and behavioral problems, and even hearing and speech problems. How are children exposed now? It's still in the paints in these older homes that were built primarily before 1978. So lead was added to paints not only to help with some pigmentation, but also the durability of the paint. So when it's put on in layers and layers and layers on the exterior of the home or on the windows, it does start to chip, peel, and chalk. So any of those high friction surface areas like windowsills that you're taking those old wood windows up and down, closing those doors and those door frames, all of that paint will start to deteriorate and start to dust, and that dust does not go away. It will just kind of float around your home, get into the soils, get into other surfaces, unless you remove it appropriately. People buy these older homes and start to remove paint and do some demolition and renovation, not knowing the risks necessarily, or don't think it's too much of a risk. It is a lot of times in the soil around the drip line areas of homes, especially if they have those older homes that are painted, or used to be painted and have now been re-sided. That drip line will collect those paint chips around the exterior of the home and gets into the soil. So other ways is cosmetics, especially from foreign countries. They will use lead for pigmentation. Hobbies like fishing, pottery, collectibles, again, can be, have lead in some of those paints. Fishing, and I remember doing this as a kid, you bite those little lead sinkers, you can now expose yourself to lead.
I'm sorry, you bit the lead sinker?
Because the lead is soft. So you put the sinkers
Oh,
around the
to
line,
close
you
it,
can
oh,
bite them,
yes,
and
yeah,
it'll go
yeah.
over the line. Potteries, again, it's in the glazes. Candies, again, mostly from foreign countries, old toys, and then there are work exposures for folks who work in like, especially in the battery industry or any type of smelting industries. So who gets tested? Ideally, children under 3 are at the highest risk because again, they are developing children. And they are at that age group that is most hand and mouth. So again, if you have dust and they're on everything and in everything, that hand and mouth is big. So doctors in Ohio, by law, are supposed to test children if they answer yes or don't know to any of these questions, or if they live in a high-risk zip code. No surprise, Middletown's old, Middletown is a high-risk zip code. The only one part of Middletown that's not considered high-risk is anybody who lives in the Warren County side, 45005. That's not high-risk. I think mostly because that's farm country. They have a lot of animals built in that area. So children on Medicaid are required. There's high-risk zip codes. You can read through all of that. But basically anybody, any child under the age of 3 should be tested in Middletown. What happens when a child comes back with elevated lead levels? So elevated lead levels have been changed. The reason why I picked this topic. It used to be any child with an elevated lead level of 5 micrograms per deciliter, between 5 and 9, would get an educational call from the local health department to just go over nutrition, risks, all of that, and then follow up with their physician. It has now dropped down to the CDC has adopted, and everybody else has adopted, the new lead level is 3.5 instead of. There is no safe lead level for a person having a body, so they keep bringing it down to get that education person. So we do all of that education in those early numbers, those lower numbers, but anybody over 10 micrograms per deciliter will actually get a scheduled appointment from the state to come down and do an environmental inspection on their home. And that can take 4 to 6 hours to do. It's a very interesting process. They actually x-ray through all the paint surfaces, take dust samples, outdoor soil samples, and a whole questionnaire that typically I would try to do before they come out because it's very time consuming as well. But they will test every single wall, they will test every single windowsill. It's just a very lengthy process. And once they do that, they can pinpoint where the highest risk areas in them are, and then figure out a plan to remediate that and make them safe again. So, in those, especially in those early stages where they don't know exactly where the risk is, these are the ways of preventing it. Big thing is washing the child's hands. Again, they're on their hands and knees, they're putting everything in their mouth, they're chewing on windows, they're just everything that's in their mouth. So constantly washing hands and keeping toys in. Again, it's the dust, and it's very impactful. I mean, if you think about the amount of salt that you will put in your Thanksgiving potatoes, it takes a fraction of that to poison a child with lead in the dust. It is such a small amount that will give them that poisonous fat. So lots and lots of dusting. And it is dusting to, it's not dry dusting, it's kind of damp dusting. So Swiffers, the wet Swiffers, the damp washcloths, things like that. That way the dust doesn't just move somewhere else. Old pipes, talking really old pipes, they say to run your, cold water for a minute or so to let any of that sediment that may be in the pipes run out before you use it for cooking or drinking, especially again for making food and foremost for infants. Home remedies, depending on what's getting put in them, those can also be risks. And when it comes to those over 10 children and knowing the risk factors, especially hiring a professional who's knowledgeable of lead-safe practices is key. Keeping everybody at home safe during renovation. That's it. Any questions? Yes, absolutely. So there are, again, for the folks who don't know exactly where the risks are, if I go over a little lengthier version of this with them, and I will tell them to look at those surfaces, and if they see any chipping, chalking, or anything like that, do not scrape it. Do not dry scrape it, do not use heat guns, but you can, again, spray it down and lightly scrape it, don't sand it, pick up all the chips, and then paint it. If it's encapsulated and it's not falling apart, then it is safer than way it is naturally sitting. But yes, you can absolutely just paint over the lead and encapsulate it and cover it up.
And is there any way to get it out of a kid?
Yes. You can, chelation is like the last thing that they want to do. But so they will retest every, 6 weeks to 12 weeks for children to make sure that those levels are starting to come down. Key is we all know that the metals in our body aren't good except for iron. And even iron too high levels aren't good. But you want to make sure that the diet is at least iron nutrient so that your body uptakes the iron and not the lead. And then lower fat, higher protein diets. Again, they're leaning toward that more with children these days anyway, but you just don't want a lot of fat, because then it'll hold into the fat, then it'll get into the system, and it actually will get into the bones. So when kids that are super high, they will find during chelation, it'll start to come down, it'll come out of their bones and organs into their blood, and it'll go back up. It's a constant jump, so we try to get them down as soon as possible. But diet and cleaning really does get it out of our system.
I don't know if you mentioned this, but often when we do investigations, the home could be completely safe, but the caretaker. So you always have to say, okay, so where's the kids? Because often when you look at the home's safe, they're not doing any remodeling, it's not an old home or whatever. It could be at the aunt's home or at the grandmother's home or whatever. So you always want to say, where does the kids spend the most of their, their time? And then you already said toys. We find a lot of times in the toys, they put the toys in their mouth, and the toys are high in lead from China with dollar store stuff when it's not regulated. So we always tell them to watch that, because they can be biting on those necklaces or biting on the jewelry or whatever, and you'll see that often when you're trying to find it. But most times the kids come down, once you remove the source, they come down, so you just gotta kind of find the source. But it's really, and Chandra, did you tell them that you were looking at a grant? But
I did not.
But we did.
Yeah, I was looking into a grant, but the state only offers it to one health department per county. So we kind of get, reached out, it's like, anybody else going to apply for this? And Butler was going to apply for it, so I just offered our input as well. So it's kind of a guaranteed money thing. It's for education on prevention. It's not for like actually testing kids, but it's getting parents to understand the importance of it. So that was just at the end of last month. So hopefully we will start seeing some promotional things come early next year for the lead awareness month.
Thank you. Okay, that brings us to old business. Fab.
Old business fab. The health commissioners, Butler County, Eric Bouster, and I, Hamilton Cities was out of town, so she did not present with us, but the FACT, Community Health Assessment, the CHOP, was presented to the FCFC. One of the things with accreditation is you have to make sure not only do you do your survey, of course, but you have to present it to your community partners. And so Family and Children First Council is Family Children First Council, what I say, FCFC, in every county, and they're made up of all people, agencies that deal with families and children. So you have juvenile courts there, all the schools in Butler County are there, mental health is there, DD is there, CBI is there, everybody that you can think of, hospitals, community health centers are there. So it's just a great crowd to present. You pretty much can check off all your boxes when you present there. So that was the first presentation. Eric had it kind of heavy on Butler County as a whole, but he had some information there for Middletown. It is on our website. We are starting to move into the community, the health improvement plan, the health improvement plan, yeah. And so you guys, I will invite you guys if you want to be a part of it. I do know that, who was Dr. Schul, and I think Larry Mulligan, it was some people from the board in the 5 years ago that was involved in that community improvement plan. It's nice just to be involved in when we lock on the 3 things that we want to work on. Those 3 things usually always is mental health and addiction, always one of them. Infant mortality usually is one of them, and the third one is chronic illness. So that's Hep C, lung disease, that kind of stuff. So more to come from that, but Eric is gonna, I think we're gonna probably contract again with somebody to help us through that process. So that is the next one. If you need a community health assessment that printed out for you, we can. Again, it's about that thick, right? And we probably, I don't know if Nancy made extra copies, but it's on there. What's best to do is download it and then just look at the areas where you need to look at it. Great information. If your agencies or anybody's looking for a grant or whatever, people always use those assessment tools just to pull some of the data. So to be continued, but that's where we're moving into the improvement plan. And then I think we're still working on the annual report that's due in January. But that's about, that's good. Ongoing. I think FAB will be ongoing forever unless, till they got everybody. I did make a note. We met with the director of health. 89 of the 112 health departments across the state are accredited. And so there was 3 more that just came on board this last quarter. So they're moving, I mean, they want 100%, whether we get that or soon. Some struggle, some of the real rural, small counties are struggling, but it's moving right along. And I think it said something about 94% of our population is covered by accredited health department. So that's what, yeah, so that's it.
Thank you. We have tobacco 21.
Yeah, and Carl can speak on this. I know we just got letters out. I think I put it in my report about 70 letters. So we're on schedule with getting the letters out in the fall. We start licensing, actually start asking them for the money in December 1st, because by January 1st, they should be licensed, right?
We're collecting payments now.
Right, so January 1st, they should be, right, they shall be licensed. So any questions, the Tobacco 21 grant, Carly, want to explain a little bit, maybe?
Right now, we've collected about 10 payments, so hopefully by the end of the year, we'll have all 70 collected by that time. The licensing is December 1st. I mean, January 1st, excuse me.
And it's the licensing, the retailers that sell tobacco.
Tobacco.
Because you must be 21 to purchase tobacco.
Now, is that if a certain percentage of their sales comes from tobacco or any?
Any sales.
Okay.
Any
I got a little
sales.
confused on that.
We were talking about, I think, doing a percentage at one point.
Yeah. And I don't know where we are with council as far as the whole, it's presented before them, and I think it's just a lot going on with council and change, so.
presented?
And not presented, but remember, I think Paul said, the city manager had said that he was going to mention it to you all as far as if it's not gonna be a zoning issue or whatever, do we want to just go on and, it was,
Last
anyway, it was in the
left
city
with
manager.
Council was that if a council member wanted to propose it, they could do so.
And they, when I say presented, did they?
Propose, I mean.
Yeah, propose.
Propose a retail density or zoning restriction.
Right. And I
Or
don't
of
know.
course, if planning commission wanted to do so.
I sent your actual
That's how our
email,
meeting
remember?
ended up, but I-
Your email, I had said, that's where Ben, they're back and forth where Ben said, I wouldn't do it, I wouldn't do it, but I think Deborah and,
That was like with them.
yeah, Ashley said it may not, if we're not restricting license, and if we're not restricting where people go, then it should be, so, anyway. Nice and convoluted there,
Mhm.
yeah.
Well,
I know.
Cause, I mean, it would be, I think Hamilton, Carla, didn't we say, I think Hamilton is looking at becoming stricter, they would have things in the paper
That
to
was
change it.
Fairfield. Fairfield. I didn't think Hamilton's, I think it was Fairfield's.
I think it was Hamilton.
I think Fairfield's looking at putting a program in.
Yes.
Mhm.
But I do think, I thought I heard Hamilton
Hamilton
was
was.
looking at retail density.
Mhm.
They currently have zoning restrictions.
They have
Right.
zoning restriction- Yeah,
Yeah.
I'm not sure about that.
Yeah.
They have zoning restrictions.
Yeah, and then they were thinking about coming back stronger, so we'll,
Well, if
We'll
Hamilton
keep
does
an
it,
eye.
maybe Middletown will consider.
we'll keep an eye on that.
Okay. 2024 budget discussion. Old business.
Okay, so.
Was that
you-
like, what was that
I'm looking at you, because normally, this budget season was a little different than all the past ones, and I think what happened, if and I'm always about 85, 90% correct, right? Okay, so that's my disclaimer. I think what happened is, they were trying to change, doing some of the salary study and to merge the two salaries, because we have two salary range. If you guys, it's confusing, and they were trying to merge them. So, it was late, the budget was late, and we still don't have, some of that, departments really still don't have what they were proposing, if that makes sense. And so you all don't have anything, because we really don't have anything yet until, and I think council was confused or had some questions about some of the, budget as well. So I will get the budget to you probably next month. We have to get it next month because we have to approve it. But what they were trying to do is look at the salary study and move people around to be competitive with other cities and other governments, as well as merge our two salary ranges, I guess what it is, into one. Because some employees were on the old range, I think it was up to 2018 if you were hired before 2018, and after 2018, you were on the new one. And they were trying to merge them together. And so that's the budget discussion. I have some of the proposal here, but it's still proposal because council hasn't done anything with them. Salary studies, I think we're trying to hire a sanitarian, because you know Janae's gone. We're still behind in the.
yeah, how's that going?
We
It's a
got
lot of work.
nothing.
No.
Two
We got
people
it.
that didn't have any registration, any
Three
sanit,
applicants.
yep,
30?
Three.
three.
Oh, I was like, okay.
Yeah. So thank God we have Sarah, but Carla will be doing a lot of the inspections along with Sarah, I know. So anyway, to be continued, but we're still behind most of the, other health departments.
Trying to be like the feds, huh? Can't get a budget.
Staying in shape, keeping up with their.
So far, yes.
Mhm. So that's to be continued, but normally you all would be, in December, we should be approving the PBO, which is Paid Benefits Ordinance. That paid benefit ordinance normally would happen in June or July, because in June or July, you meet with the committee, and you say you want X, Y, and Z added to your budget, whatever that is. It might be another sanitarian, or another nurse, or whatever. They take that back to the finance department and the city manager, and they work the numbers, and they either say, yes, you can have it, or no, you can't. Yes, you can have it, then your budget is then produced by your staff, because you have either more employees or a new range or whatever. So we haven't done that either, but anyway, that will be coming to
What's
you
the whole,
in December.
I mean, it can't be the one pushing, council push the vote back one meeting.
No, it's not
That
like
can't
that.
be
It's
the
not like
rest
that.
of-
I don't think it's you guys. I think, to me, what happened was, just trying to merge all of those things together. That's the only thing I can think of. And then maybe the short staff in the finance department too. But I think that's I think that would, it wasn't part of the department heads or whatever, it was the people that were moving those, you know what I mean, numbers around. But we have to check. The salary study, I do believe, was back. No one had saw this, we didn't see the salary study. I think it was back.
Should be a public document.
It's out there now,
I haven't.
yeah. It's out there now, but,
Okay.
yep. So I think it was just all the stuff moving around, and maybe it was finance, remember with the finance, with staff and the finance? We were all kind of waiting, and this is pretty late this year.
Okay, well, next month we'll talk about the budget.
Yep.
Or approve the budget, I guess? Okay.
Yep. I'll get it to you guys as soon as, even if it's before, so you can look and have any questions on it.
Okay, so for new business, travel authorizations.
No, we have any?
Nothing there, okay. That brings us to any open discussion from board members. Does anyone have any topics they want to bring up?
You still at Central Connections?
Yeah, kind of. Yeah, they have a committee that was formed, and so I think they've had 3 meetings so far. I was present at 2 of the 3. But everything over there is still operating just like before, and it's just to be continued, I think, with the discussions of what's the best use of the building, who will run the building, et cetera.
The city hired a staff member to run it now.
A staff member, city manager, and one of the staff member over there versus a volunteer, because opening and closing of the center or whatever, we wanted somebody, so it's a part-time staff person under there, 8 out of city manager's budget. I kind of pseudo supervise, but it's really, I mean, opening, closing, being there, making sure seniors are safe,
Yep.
directed in the right way.
I had a question about demolitions.
Yes. We do nothing about them, okay, I can answer this one real good, yeah. I can make up this
Buildings.
one. I can make up this answer real good, okay. Demolition of buildings. Thanks, Jeff.
Does, the health department have any, part of that process determined? That's what I thought. Okay. I was told by Development Services that here's the process for, because I saw the article in the paper that said Middletown is submitting a bunch of demolition sites to the land bank for demolition, for lack of a better phrase. I asked, what's the process? First of all, what are the sites? Because here's what, from an economic development perspective, we keep tearing our city down, and vacant lots are about the worst thing you can do for the future of your city. No one ever develops on them, they become gaps in neighborhoods, in commercial areas, and then you essentially are shooting yourself in the foot. And we have a ton of people who want housing, who can't find it, who would love to rehab an old house. And we, as a city, just continue to tear stuff down, and it is a massive problem. So I asked the process. and I got back, the city of Middletown receives complaints to address dilapidated and dangerous properties from multiple sources. These complaints are typically received from citizens and/or city staff, including code enforcement, the fire department, the police department, the health department, etc. Properties can only be condemned by the order of the chief building official or the health commissioner, after a determination has been made that the properties are a danger to the public safety. So, I do not question whether the health commissioner has the authority. It makes sense, right? If there's a public health issue. I followed that email up with how many of the properties on the list had been deemed a hazard by the health commissioner.
The answer has to be
The
zero.
answer is zero.
I've not received an answer.
Oh, okay.
Because where that is going next is I'm going to ask for the structural review of every one of those buildings from the building department.
Yeah. And the only,
I've looked at these properties.
Coming out of the library.
the old library,
Yeah,
on First.
yes.
What did you?
She said she saw multiple police coming from out of the library on First. Remember the old historic one that we're supposed to be, that's supposed to become a brewery?
Oh, the Carnegie.
Yeah, that old one on the right.
Yeah.
Mhm. So but I do know, Carla.
We can deem a property uninhabitable
Right.
with certain public health issues, but
Sure.
none of those have we had any.
We don't have any of those, and she's probably pulling, I would think, probably some code information, but like.
And I feel, I'm not questioning, like
Oh,
I
yeah,
said, like
yeah,
whether
no,
you
yeah,
should, of
no,
course, like I
right.
get that, but I guess my question was, has the health department been heavily involved or had any,
No.
have you ever deemed a building to need demolishing from a health perspective, since you've been here?
And I think, when Carla helped me out here, I think like if we move in the future, remember we talked about our septic issues? And if you can't do a septic and the septic's failing,
Yep.
you'll have to abandon that home. And so the Board of Health would do an order to abandon a home that cannot be, what do you call it, brought up to code because of the septic issues or whatever. So we would,
Right.
we're in that
I can see
realm,
that.
and never have done that
Or
in my
so
time.
uninhabitable.
Yeah. And then we looked out before, we used to go out a long time ago with zoning and stuff, and you could see a house that had a lot of stuff in it, whatever, but we're not talking about structure. We're still talking about debris and if it was like a hoarder or whatever, and we can say inhabitable, right? Once they get it cleaned up, then it's up to them as far as the structure of the home. Or the wiring and stuff, we don't do wiring and that kind of stuff, that would be zoning or building and code. So your answer is like.
Okay. Thank you.
You can drive past certain homes and just see the clutter piling up in the windows.
So, right, and that's code violations, and that's a lack of enforcing our code, which is also another problem, by the way, because we have 5 full-time employees. Full-time employees. Have you ever seen a code enforcement vehicle driving around the city?
I don't know what it looked like.
What's
Have you ever seen a police cruiser driving around the city?
The city, yes.
Of course you have. Why haven't you seen a code enforcement vehicle? Because we have a very similar number that should be driving around us. We have them. They're not driving around. And so what's happening is code violations are going rampant. They're getting addressed when people complain, but we're not proactively out there doing that. And so we're getting crap piling up. But that does not mean that a home is demolished. Like, you can save so many structures, but when we start demolishing, the whole thing goes to hell. And we're in a really bad spot right now because we're not trying to save the city.
Well, the worst part, forget that. What about all these empty lots and all these things that they tore down, the old high school, and, I mean, they just sit there year after year after year, and they say, you know, I don't know what they say, but, I mean, what the hell are they doing? I mean, they get
So,
torn down.
the
not
bigger
torn these
sites-
days, but
The bigger sites, first of all, yes, many of those should not be taken down. The bigger sites, at least you can get a developer most likely to come in and put in some new development in that's gonna have less quality construction than what was there before. It's gonna, regardless, it's the onesie twosies in the middle of the neighborhood that will never get built on, and if you build on them, they're going to be really poor construction. And that's the problem, and it's deteriorating our neighborhoods. And I've been going to other cities trying to figure out what's going wrong in Middletown, and that is a really, really big issue. So, it's good to hear that we don't have health issues that are resulting in that. Now I can take it to the next step and figure out what the structural issues are with these buildings.
Well, who's the ultimate arbiter of this? This must be the city council, right?
No.
No?
I read it in the Journal News,
Well, I mean, who's the ultimate,
the building inspector.
that's the ultimate of ultimates? I'm just asking.
Mhm.
Really? Wow.
Yeah, okay. You can see I'm on a crusade on this one, okay. Any other open topic discussion? Oh, I wanted to talk about terms, so of course I'm not running, didn't run for mayor again, so you, will have a new president of the Board of Health on the, starting on the 1st of January, will be Elizabeth Slamka, I believe, right? So, I have one more meeting to go after this. I'm sure you'll see me at Citizen Comments at 7:30 in the morning. And then I just wanted to remind, I think Emily's position is, so obviously you have a short term. If you decide that you want to continue to join this party crowd, just remember to reapply for the board and commission. That way council can reconsider you at the beginning of the year. I think everybody else is good for a while, at least through next year.
And I'll thank you for your service now, and then again next month, when you'll get probably a public health something. We have.
Public health.
So I give you a vaccine free.
And a demolition.
And a demolition. Yeah, but, thanks, Nicole. I think what is wonderful about mayor serving as the chair, it used to go around, because, remember in the old days before you had direct elected officials, mayor, it used to be passed around to the council, and the council, we had different mayors that kind of got a taste of public health, and then Larry became a direct elected mayor, and then he served for 12 years, I think he was here for 12 years. So having a new voice and face and understanding of that is kind of cool. And then Elizabeth will be cool too, because you'll get more eyes and voices in public health to not only learn what we do, but then to do it differently and better, right? And so I appreciate you looking at all of that and understanding, right, all of that, because like you said, we're in the Ohio Revised Code often, but have very little authority and teeth, because other things can supersede us as you come, different, zoning and building and all the rest of it. But really and truly, I'll promote this all the time, if you want a system that is very solid, you would have public health embedded in it, because that's everything. You could build homes, but if you build it on a lead shooting range, like one development did in one county, and all the houses had to be torn down because you didn't remediate the lead. So public health, if you kind of have them at the table, just to double check, are we missing anything, putting another, set of eyes on it, it makes a difference, because we know things like septics, we know things maybe that builders are not thinking of, or departments aren't thinking of. So it would behoove them to do that, but again, larger cities usually have it, it's part of it, it's always public health, it's police, fire, and public health, because it's public safety, and it all kind of goes together. You can make sure all different edges and ends, but to be continued. Sometimes we kind of chase our tail, and we'll get there eventually, but we'll see. But you do have a strong public health system, because we have our emergency preparedness plan, and we are up to date on most of the emergency things that are in, federal government or whatever, so, and that's part. But really quick, you're right, I have Mayor down there, Elizabeth will be coming in. We have been instructed, yesterday's meeting, they instructed all department heads to get a little snippet of a PowerPoint for the new incoming council, I guess, so they're gonna do a whole, instead of just orientating just a small piece of it, all of us are supposed to do our dog and pony show in front of all of them, since they are pretty much all gonna be new incoming. And I think it may even be 4 instead of the 3 because of, Councilman Reederspaw. So, we'll get that together. Again, I'll put that in the packet. It will be similar to our orientation to the board, but probably just kind of what we do, how we inspect restaurants and that kind of stuff. It'll just be kind of an overview. We'll go into a little more depth with Elizabeth, and then to be continued. We'll probably have to, don't we select new, every year, we select new personnel committees and finance committees and that kind of thing, so. And last but not least, I put it in your packet, the Middletown Connect is moving on. Really interesting things that is breaking my heart again, but you know, the phase 2 will be moving on into the Amanda area and the Latino area. Amanda area, you had brought that up, I do believe, at a council meeting, what are we gonna do with the Amanda area? And it would be nice to be in lockstep with the city as we talk to the residents. But one of the things that kind of broke my heart is, that's true, they have no sidewalks down there. And so when the buses come or the kids walk to school, it's kind of dangerous. And so we're thinking about some of those kind of things, maybe the low-hanging fruit that we can maybe help with some of our businesses and our city. So we're gonna try to get that together, but that some of the kids that, you know, that don't get buses, a lot of them are in the neighborhood, are walking in the street. And so that was one of the obvious things. With the Latinos population, when we talked to them, it was about language barriers and healthcare and places to go, safe places to go again. So to be continued. Again, these community things that you supported, but it really needs, we're trying to bring the city along with us because we don't want to duplicate things, nor do we want to promise things that are not going to happen. And we may be able to find grants to help the city implementing these things. And so to be continued, but it's in your packet too. I'm not going to go into details with that, but it was some good information that's all in here. So that's just it. Thank you to Sunrise. They came and the crew came and everybody loved them, and they came and helped clean the windows at Central Connections because there's a lot of glass and a lot of windows there. So, and that was through Ruth, and we appreciate that, and Nicole Ward. So she helped us out as well. I think that is it. That's all my report.
Okay. Chandra? No, not Chandra. Well,
Yeah.
are you doing?
Chandra, and yeah, she's gonna do the medical and the nursing.
Just gonna do both of them together. So communicable disease report this month, reflects the 2 Brucella cases that I discussed last month. The Campylobacters that I discussed with y'all last month. We had 20 chlamydia, 193 COVIDs, 13 gonorrheas, Hep C is at 6, and Hep B is also at 6. And then we are into pneumonia season, so we saw a couple of cases of strep pneumonia, and we did have a case of pertussis in an infant who was a high-risk infant, but was not associated with any daycares or schools, so that was a good thing. So that's our communicable disease report. For the nursing report, just to let you know, we do have our flu vaccines available, so if anybody wants to get one for me, please see me. We are starting to see some flu cases come in that are being reported by the hospitals. I have not seen any hospitalizations for our residents yet, but the flu is here officially. And I know that there are hospitalizations happening around the county actually already. So definitely protect yourself. And then another thing, since Janae has left us, I have taken on the role of our emergency preparedness coordinator. So you'll be hearing about that updates as the public health emergency preparedness program grant that we are under. So you'll be getting updates on that from me probably each month as well. This past month, we participated in a statewide MCM, which is medical countermeasures drill. So basically what that is the state says, in this case, they chose anthrax. We're getting these medicines from CDC, shipped in from Atlanta to Columbus, and then Columbus then parses it out to each county, and each health department then has to go to a regional site to pick up our allotted and get it back. You know, all that has time, and coordinated with EMA, everything. So we participated in that exercise last month, so, and overall, it went fairly well. There's always room for improvement. Communication being always the top thing that needs to be improved. So, we all learned from that exercise. And then we also had a deliverable due, for the grant, which was also, an update to our emergency communication plan, which we had already done prior to that exercise. It was just a deliverable that was due, this month. So that was taken care of as well. And one of the biggest keys of, the hardest thing, in my opinion, to come up with during these FEP requirements is a multi-year training plan. It's a 5-year training plan, which is a hard thing to predict out what we're gonna do, but at least we are adding into our training plan each year. And I'm proud to say that our front-end staff did a CPR training last month as well. So that was a really good receive preparedness training, if you remember that. So we now have a couple more CPR, AAE, and first aid training individuals.
Yeah, and that's one of the reasons why we need your, forms, where,
The NAP
the NAP forms in. You remember when we passed that around to everybody, name, address, phone number, those NAP forms is so that we would have anybody in your household that may need antibiotics during anthrax. And so the board would be that first line, people that we would, prophylax to do that. And so, and you don't have to fill them out if you don't want to, just know that you would not get any antibiotics.
You wouldn't be
But,
included in our account.
yeah, including the count, because if something were to happen, they want to get it out to your first line defenders first. And that's why we do police, fire, council should turn them in, and, Board of Health. Because that would be the people that would start being the top of our incident command if we're having an anthrax attack.
In the world. They say anthrax.
It's just imaginary.
Oh.
But anthrax is naturally occurring. It's very commonly found in the soil and in the prairies. It's a scary thought. It is a scary thought. But no, it's imaginary, and we got a bunch of empty bottles of antibiotics
Okay.
that are not allowed to throw away. We have to ship them back or keep them. So
Or
we're
give
keeping
them
those.
out. I just text Jeff.
That is my report.
Unless he blocked my number.
Thank you.
Carla?
Okay. Sarah and I have been really busy this month. Let's see, we approved plans for Waffle House, Brant, Distillery on Roosevelt. We've had 3 micro markets we approved at Cleveland Cliffs, Lowe's, and International Paper. A body art facility, all household tattoo, we approved, and he should be opening soon. Salon Halo, which is a body art, we approved that, and it's open. We received plans for another permanent makeup at Masters Touch Hair Design. So currently we have 5 tattoo shops and 5 permanent makeup shops around the city. So,
How exciting.
yeah, very. We both went to training at Sinclair College, which is a annual training. So that was in October. And we also, had our, Ohio Department of Health came down and surveyed our pool program and the campground. So they surveyed years back from 2019 to 2022 for the pool and campground 2018 to 2022, so they were behind. And normally they come out yearly, but they were behind, so. we went-
Helpful.
Yeah, very helpful, trying to find all those, documents. So hopefully, we haven't gotten the results back yet. From what I understand, they're behind on getting the results 3 or 4 months, so.
And they're putting a lot of health departments on provisionals.
Yeah, hopefully.
Yeah, so
She did
hopefully
it.
we won't.
Yeah.
Yeah.
For the
Provisionals would mean that you are missing things.
Yeah.
And you're kind of like on probation in a sense until you get them done. And a lot of health departments were complaining because of the delay of getting back the report and the delay, and I think it was a lot of the restaurants, remember, were closed, or I'm sorry, a lot of the pools and stuff were closed during COVID. And their mistake was they didn't write it down, unable to inspect due to closure of COVID. So that was their violation, that they didn't write it in the files. I think that's correct, Carla? So a lot of health commissioners, we were at that meeting with the state and they were livid. This is the first time we've been on, and is it your goal to put all your health departments on provisional status? And they were just fussing, and it was some of that.
And luckily, luckily we had in the files the ones that didn't open, and we did inspect the ones that were open, so we had that documented, so,
Good.
yeah,
Yeah,
hopefully.
And we were one of the ones that didn't close too, right? A lot of health departments closed down during that time, and we were open, so it helped a little bit.
And, again, like Jackie said, we had to send out the T21 letters, we got about 10 back, so we'll just, Amanda and I keep processing whatever come in. You may send out a second notice, so it's because the end of the month, we send them out a month early, 2 months early. So in 30 days, we'll send another
What's a
letter out.
T21?
I'm sorry, tobacco 21.
Oh.
Yeah.
Your
So-
favorite topic.
Yeah. So.
He's traumatized.
So we'll probably send out a second notice at the end of the month, just to remind the businesses to get their applications in. Other than that.
Can you remind me where the Waffle House is going?
Commerce Drive, 3455 Commerce.
Where is it?
By the hospital.
Okay.
Hospital,
No,
no,
it's by-
no. Oh, yeah.
By that McDonald's
Where the
over
BB
there.
Oh,
is.
okay.
Mm-hmm.
Kind of weird, wasn't it there before or something?
Yeah, right, right.
I was gonna say, wasn't it there before?
What about the 513 Indian
Still no,
place?
yeah, I haven't got anything from them
Really?
yet, no.
They like put an ad?
We haven't got
Oh, I want it to be good.
I hope so.
I don't know, they have all these things, I look at this, at all these restaurants that you're doing, and then I think to myself, when I wanna go out to dinner or eat something, where can I go? I mean, it's amazing.
Yeah, well, I don't think you wanna go to a
Give me
wine.
one good restaurant
There's no such thing.
in Middletown.
That's what tastes good, that's why they all taste good now. It says you guys are just too close to the matter. You're too close to the matter. You just- Yeah, you know now.
Mom,
But
we've got
no,
a place called the Food Court down here.
What about Cancun still? Is it, because everybody keeps asking about that
Yeah,
too.
Sarah and I stopped by there about a week ago, and he was still trying to get, his, hood system straightened out. He couldn't get anybody out to, do the work on the hood system,
Hmm.
so.
Somebody said Golden Corral's coming back to Middletown.
Well, I saw it in the paper that.
Is that what it was in the paper?
Yeah,
We didn't-
they
I don't know
were
anything about
looking
it.
to come back to 2 locations, and one was Middletown and one was, somewhere in Cincinnati, I think. I'm like, okay.
That made me wonder if they were actually.
But, Cancun looks really nice inside.
He's gonna get a Chick-fil-A. Where's he gonna go?
Where?
Chick-fil-A.
I haven't gotten a notification of that yet, so. I'm gonna be the last to know about that.
Yeah, seems like.
We really are.
What about that one you showed us pictures of the one day?
Oh, runaway taco.
Twice and
They
then
look, yeah, they look.
I'm just like,
I get it, stop.
You ran away?
They're open.
they've had a big sign up that says open.
Really?
Where's that?
Where's the Yankee Doodle?
Across from the old, what's the name of that school?
Oneida?
Yeah, I Sarah and I just trying to keep up with everything. We're really busy, just trying to get the schools done, before the holiday. They have school inspections to do, and, mobiles and things like that. I stopped by, also stopped by a place, I was doing a tattoo inspection, and I stopped by a place I saw a mobile, and they were going in and out of this building on Yankee Road, and I'm like, I wonder why they're going in and out of here. So I stopped by, and they had set up a whole shop of coolers and prepping food inside the space that they didn't even have approval for.
You just
So,
set up.
yeah,
Can you
that's what the
say
place
like
was, though.
coolers?
It's really good. Huh?
Like coolers,
Big.
like.
Yeah.
Oh, commercial.
Okay.
Commercial,
I
yeah.
make sure you know we're going tailgating.
Yeah,
Yeah.
I mean,
Okay.
yeah, so, and they were out of, they actually had their license out of Hamilton County, and I'm like, and I called the director there and just let him know that what they were doing, but I told the guy, I said, you need to get this out immediately, so.
That's the proactive stuff though, that is awesome, I'm glad to hear, but I feel like we don't do enough of like, I saw something and I stopped and did something about it.
Yeah.
Yeah,
Thank
well, the
you.
same thing happened on Titus, and another guy had a mobile, and we saw, and actually, the building department didn't tell us about this one, and I had Sarah go back there, and he did the same thing. Like, we just set up shop, he was using the building as a commissary. And if you do that, you can get licensed to do that, you have to go through the Department of Agriculture, but you just can't set up shop with no permits, no building permits, no nothing, and you're utilizing the facility. So we
Is
see
there
that.
a house on Central, like downtown, that grills out
Go front and feeds people for free.
for free?
I think I heard for free. I've never, yeah, right down in that area
Where?
by the
By Ted's
Poodle,
Road?
yeah, Ted's.
Oh, that's the one
with
that's
the pink
like
poodle.
next to where Olivia
Yeah,
lives.
right.
One that has the little yard sales out there.
All the time, 24 hours.
It is,
Every
it's
day.
free.
That's what they said, they're doing everything.
I'm sure they said that, yeah.
I mean, that's what I
Next time you
hear.
see-
It's like every day, it's
Donation
like,
bucket out there or something.
Sounds to me like everything is just, it's the Wild West, everybody. everybody
well,
doing
Carla's
anything.
trying to crack the whip on it.
No, seriously, I
good
mean,
sheriff.
it sounds like everybody's just doing whatever they wanna do and.
Well, really, unless you have enough, I mean, people, like when they're out, inspectors are out, they're trying to look at everything, building things. You can look at restaurants and kind of tell, did they get a permit for, you can kind of, we saw a lot of places downtown that weren't doing correct things, cause you gotta get out there and see. The problem is, if you don't have enough staff, we have 1.5 now, and probably just one, cause Sarah still is sanitarian training with Carla, but we do try to be proactive like that, but we are also looking for it. I mean, when you go out, you're just not going, do. You're out there looking at, different things, and you're finding that, did they get a permit for that building, or, and that's what's really important, you guys. By the time people even call and complain, sometimes it's really too late, because the train has really left the station, and so then things are tied up in court. Like, by the time you say people are building things or doing things that they don't have permits for, it's kind of, so, I mean, but to educate your community and to educate people. But we get calls all the time, don't we, from people that tell us that people are doing things without a license, and tell us. That helps us out too, but sometimes if you're just not out there watching it, people do a lot of things that.
They shouldn't. Well, thank you for stopping. Okay, anything else anyone wants to add? Okay, then we will adjourn until the next Board of Health meeting, which is December 12th, 2023, 7:30 a.m. We'll see you